And I think that what we'll do is just to sort of follow the order that has been randomly put together here. And we'll have Vic Luna, who is a caregiver, begin by giving his story. And we'll sort of work our way down the list. And as questions arise, comments arise, please stand, identify yourself, and ask the question, and we'll go through what I think will be perhaps the highlight of the whole day's experience.
Good afternoon. I feel honored for being asked to be part of the panel. Maggie, thank you very much. Doctors, appreciate the opportunity. I'll begin with giving you the story of why I'm here. It started back in 1964 with my wife. She was 9 years old. She lost her grandmother to pancreatic cancer. Not old enough to know anything about this cancer, much less how it would affect her life 30 years later. She had no clue that the very same disease would steal her father, her mother, her grandmother, her uncle, and in 2002, her own health. And I'm sorry if I lose my tone of voice, but it's very emotional. We noticed my father-in-law was not feeling well when he came out for Christmas in 1997. We contributed to that minor accident that he had on the way to the airport, not feeling well, in 1998. We were preparing for our oldest son's graduation from UC Berkeley when we were hit with the news that my father-in-law had pancreatic cancer. To hear these words, "I'm sorry, it's pancreatic cancer, there's nothing we can do. Go home and put his house in order." We were shell-shocked and lost for words. We were told, go home and enjoy what little time he had left to live. We were making weekly trips to New Mexico to assist him and my mother-in-law to be able to deal with what she was going through. It was devastating news to her, and she didn't know how to handle it. We were all trying to cope with and understand what pancreatic cancer was. What was very gut-wrenching to us is to see my father-in-law, a person, healthy, 175-pound man, withered down to 70 pounds. 70 pounds in such a short period of time. We learned that pancreatic cancer doesn't just affect the patient, it also affects the family. My father-in-law only survived a few weeks after his diagnosis, not the 6 months that the doctor said that he would have to live. At his memorial, we were stunned to also learn that his mother had died from pancreatic cancer. In February of 2002, my father-in-law's youngest brother was diagnosed with cancer, pancreatic cancer. He died a few weeks later. In February 25th is when he passed on, just a few short weeks after diagnosis. And on April 1st, 2002, a few months after losing her uncle, my wife was given the news that she too had pancreatic cancer. The doctor, not knowing and only given her the news that she had pancreatic cancer and did not know the history of her family, said, "I'm sorry, there's nothing I can do for you. You already know the survival rates. Let's start you with treatment to help you with a few extra months." And again, we heard the words, "Go home, put your house in order." Those are terrible words. Pancreatic cancer wasn't done with us. In 2005, my mother-in-law was diagnosed with this horrific disease. The disease stole her husband, and she survived 8 years, a little longer than expected. Our story isn't meant to be heartbreaking, but rather an inspirational one by defying the odds and how, through the good, the bad, and the ugly, we've weathered the journey. My wife has been in the unique position to be a caregiver as well as survivor and inclusion. I thank God for blessing us in being able to congratulate my wife that on April 1st, she will be a 60th year survivor. And to her, I want to tell her that I love her. And please do not give up, because we're going to fight right with you. God bless you.
Vic, thank you so much for sharing that. I want to move down the aisle.
Of course.
And have you speak next.
Sure.
Would you do that? All right.
Should I? Good afternoon. My name is Ani. I am a caregiver, a supporter of a pancreatic cancer patient, my mother. And I want to say thank you, of course, always to Aggie and especially to Amy, who called and said, would you speak today? And I said, absolutely, it would be my honor and privilege. We were here last year for the first time as sitting right there, and honestly, we were at the very beginning of our journey. My mother had just been just diagnosed, and it was a goal for us to make it here today. So it really is an honor and such a privilege for me to be sitting here. In the week between Christmas and New Year of 2016, my mom, Minnie, was diagnosed with pancreatic cancer. It was not an awesome holiday for my family. We were much the way Vic described. We didn't know anything about pancreatic cancer. So to all of us, it was a feeling of dread. We were terrified, felt like there couldn't possibly be any options for us. What we knew at that time was, well, all cancer is terrible, but the one you really don't want to get is pancreatic cancer, because there just is no hope for that. So for myself, my father, my brother, the grandkids, all of us, it was true desperation at that time. What are we going to do? How is this possible? We had no cancer or pancreatic cancer in my family. We didn't know anything about it. My mom had been in the most perfect health, we thought, in terms of how she operated on a daily basis, her energy level, her involvement with both myself and my brother and her 3 grandsons. She was just so energetic, so hands-on, that it just was impossible to imagine that she was this drastically ill. And once we did find out, honestly, it snowballed so quickly. She became very, very ill so quickly. And, her bile duct was impinged, and all kinds of complications came with that. And we immediately went to see a surgeon in San Diego who said, oh, there's this thing called Whipple surgery, and let's schedule you for next week and we'll get it done. And we all went, oh my God, that's fantastic, there's a solution. And then we went, oh my God, no, hold on, this doesn't make sense. I researched the internet exactly one time, and then I shut that down for myself. I could not do that. My brother, on the other hand, was all about it. He found the Hirshberg Foundation, who then, with Amy's help, immediately referred us to the UCLA team Dr. Donahue and his team, and we found out that no, there's way more of a process than let's schedule you for surgery next week. They, did what they needed to do, and as he described, the whole team worked on it and came up with a plan, and that made sense and gave us a lot of hope. And without going too much further, because I could probably talk about this all day. The one thing I would say that really, really got us through that very difficult time was that my mom ended up setting the tone for how the rest of the family would respond to her illness. And it's funny to me now. She was not, at least not verbally, down or despairing. She was annoyed. She was so annoyed that she'd gotten cancer. She was irritated that it was now going to take her away from her grandchildren and that now she would have to, do this thing to get better. But the underlying theme there was, I'm annoyed, I'm going to kick its butt, and we're going to move on, and we just need to get this done. So it was helpful. It was really helpful in setting the tone for us in going with that, and just kind of looking at each other bewildered, going, "She's serious? Okay, let's do this." And we just kind of jumped in and made it happen. And long story short, 3 months of chemo. Back in May of last year, she did have her Whipple surgery with Dr. Donahue, and then 3 months of chemotherapy after, and now we are about 8 or 9 months post Whipple, and she's here filming me, so. Thank you.
That was great, honey.
Thank you.
Me?
Thom?
My name's Thom Mrozek. This past Thursday was the 6-year anniversary of my Whipple procedure. How cool is that?
Very cool.
A couple of takeaways from today. I love Aggie, Amy. I wish I could do more for their, if I could, I'd quit my job, I'd go work for them for free and do everything I could. People like Dr. Donahue, the other doctors and researchers are here. Thank you. You're doing things for me, for Lupe, and for everybody else that's here in this room. And the difference in what you hear at a conference like today as opposed to 6 years ago is fantastic, and is the result of all of your time and labor and love and efforts so that there can be more successful outcomes like myself. And I'm just so grateful for that. Because every time that I talk to a new patient, I can tell them, well, back in the day when I got diagnosed, you were kind of screwed, type of thing. I got diagnosed on Leap Day in 2012. It's the only reason I remember the day. And it's funny what you mentioned. I was kind of pissed off because I'm a lifelong golfer, air quotes. And I'm not very good. But I was in my late 40s at the time, and I decided, I really, after 40 years or 30 years of golf, I need to get my act together. So I'd spent like a year and a half of taking lessons up at Brookside, up in Pasadena, every week, and going to the range and working on it. And you know what? It was coming along. And then I got cancer. And I was like, God damn, really? So I had the surgery, and about a week after I was diagnosed, I had already actually booked the surgeon. And I consulted with a number of oncologists after there. I was stage 2B. I had a bunch of dirty lymph nodes, so I needed adjuvant therapy. Margaret Tempero was one of the doctors that I met with through various connections that I had. I'm very fortunate to be able to exploit those. And I made it through the 6 months of FOLFIRINOX and About 6 weeks after that, I pulled the golf clubs out, and I hadn't lost everything, it turns out. And within 6 months, I was playing the best golf of my life. I'm now back. I regret to inform you my handicap is the highest it's ever been in my life right now, but I'm continuing to work on that. I'll leave it at that.
Can you hear me? First, I want to say 5 things that only a Whipple warrior can relate to. You would rather leave the house naked than to leave without your pancreatic enzymes. When going out in public, the first thing you do is scope out all the restrooms. You cannot resist showing off your Whipple scar. You are in love with your surgeon. He represents the whole medical community you have come in contact with since your journey started. You now have a new holiday, your Whipple-versary. Well, good afternoon. My name is Lupe Romero, and Aggie, thank you so much for having me on the panel with my friends. It means a lot to me. I love you. I would like to share with you my journey with pancreatic cancer, the many forms of caregiving, the importance of staying positive, and my faith. My journey began on January 11th of 2012, exactly 1 month after my 50th birthday. I hadn't been feeling well, and since I work in a hospital, I just assumed I was on the 5th round of the flu. The itchiness and the dark brown urination and the neon green stool I thought were due to food poisoning. The constant severe back pain I attributed to many years of training and running marathons. But when it felt like somebody punched me in my kidneys, I knew it was time to see my doctor. She ordered lab work, which came back abnormal. I then was admitted to the hospital with the initial diagnosis of gallstones. An ERCP was scheduled the next day to remove the gallstones. In the interim, I had a CT scan. Then the next day after the ERCP, my husband and my boys were pulled into a small room, and they were told that I did not have a gallstone, but in fact I had pancreatic cancer. They were given the facts of this horrible disease, and then they were told I had 3 to 6 months to live. A couple days later, a surgeon came into my room, and he said that the fact that my tumor was only 1 centimeter and at the head of the pancreas, there was a 90% chance that this tumor could be removed. My family was excited. My husband and I were nervous about the 10%. 4 days after I was diagnosed, I was taken into surgery. The surgery was supposed to last 8 to 12 hours, but only after a few hours I was taken to the recovery room. My husband and my boys were once again pulled into a small room. They were told that the tumor had attached itself to the mesenteric vein, and there wasn't anything more that could be done. Again, they were told I had 3 to 6 months to live. Needless to say, they were devastated. My husband said it felt like the whole building collapsed on him. He felt numb, as did the rest of my family. While I was in the hospital, one of the radiologists that I work with came to my room and he said, "Lupe, this hospital that we both work at is a great trauma hospital, but it is not a cancer center. You need to go to a facility that specializes in pancreatic cancer like UCLA." Well, I had never been sick, and everybody else kept telling me that I was in the best place that I could be, receiving the best care. I actually felt a little annoyed that this doctor said that, but I didn't think anything more of it. Then I met my oncologist while I was still in the hospital, very young oncologist. He looked like little Doogie Howser. I was thinking, oh. But he he was excited about a new treatment that had just been made available a few months before called Filfornox. This chemotherapy was known to have very harsh side effects. He said the fact that I was in great physical condition and fairly young, he felt I was a great candidate for this new chemotherapy. He presented this chemotherapy to the tumor board, but he was voted down because the rest of the doctors felt that since these side effects were so harsh that it would impact my short remaining life. And that bothers me too, because I had already agreed. That was my choice, not theirs. I then remember, then I when I got home, then I was started on gemcitabine. I had 3 months of gemcitabine, and then at the end of the 3 months, I had a CT scan, and there was absolutely no change. This made me nervous. I then remembered what the radiologist had told me a few months back. I called UCLA, and I made an appointment, and I met Dr. Hines, and I met Dr. Weinberg. I had after the consultation on the way home, I commented to my husband that I felt a sense of peace, and I knew that I was in good hands. When my doctors at UCLA communicate with my doctors in Mission Viejo, I was then started on the multi-agent chemotherapy Filfornox. On my first visit, I was told that I would lose my hair in 1 week, develop horrible blisters in my mouth, have horrible diarrhea, and I was going to get so sick that I can have a nurse sent to my home if need be. Surprisingly, I tolerated this chemo extremely well. After 6 to 7 hours of infusion, I would go home, and then I would walk 3 miles. The next day, I would hike 3 to 5 miles while still hooked up to my pump, and I continued to work full time. After 6 months of this chemotherapy, Dr. Hines performed a successful Whipple surgery on January 29th of 2013. I had a great recovery. 6 weeks after my Whipple surgery, I jogged the last mile of the Los Angeles Marathon with my dear friend Julie Weiss, who at the time was jogging or running 52 marathons in 52 weeks to raise awareness. I then went on to complete 2 half marathons and a full marathon, which was my 11th Los Angeles Marathon. And also 9 months after I was diagnosed, I took up skydiving. I literally jumped back into my life. But 1 year and 6 months later, I had a reoccurrence. My husband was sick of a different illness, and he stayed strong for me. But the news of the reoccurrence was too much for him to bear. He died 2 months after my reoccurrence. I then completed 30 days of radiation and chemo treatment, Xeloda is a pill. Then after that, I was started again on the Filfornox. But this time, the experience was totally different. I could not eat or drink a drop of water for 5 days without having these violent attacks of vomiting. I had this overwhelming production of saliva where I would constantly have to tuck a washcloth in my mouth. And then I had this strange sensitivity to cold. I couldn't touch anything that was cold. I couldn't walk barefoot or touch the refrigerator door. And even if I were to open the refrigerator door, just that coolness brushing my cheeks felt like a combination of frostbite with an electrical shock zapping those areas of my body. My recovery would take up to 7 to 10 days. And I started getting so sick towards the end that my nurse was getting to the point where she refused to administer the chemo. I was able to do 11 of the 12 treatments, but thankfully my tumor shrunk and it went dormant, and I haven't had chemo for over 3.5 years. Early on, I made the choice to stay positive and strong. After my reoccurrence and after my husband passed away, I went to Mexico and I climbed pyramids and volcano ruins. I went horseback riding. I've also gone to Washington, D.C. a couple times to advocate for more funding for cancer research. And I continue to skydive. And yes, I would love to invite you to skydive. I'm going to go for the 7th time, April 7th, if you'd like to come. And so who goes skydiving after she's diagnosed? And then, in the middle of her journey, who starts a business? Me. I just launched my gift to myself. I launched my online business called Strive to Survive.life. This is more than a clothing line. I'm starting off really slow, so there are T-shirts for survivors and for caregivers if you want to offer your support. But I'm not a businesswoman, so I'm just following my heart. This is an extension of my advocacy. I'm starting off slow, but my website is going to be a resource center for newly diagnosed patients, and I want to share all the information that I have learned, like the information that I have learned here. And also, the most important thing is that at the end of each month, I will donate some of my proceeds to cancer research, different organizations like Aggie and Hair Foundation. It's my giving back, my way of giving back to my cancer community, and also because I'm so grateful to be a 6-year survivor. This journey is far from easy. I struggle on a daily basis, but I know I'm not alone in this journey. To me, a caregiver is someone who gets you through the day, especially the tough times. Anybody who knows me, could you please raise your hand? Wow, I didn't realize all of you knew me. Well, these are my caregivers. You're all my caregivers. It's just, it just overwhelms me. Aggie and Amy came to visit me at the hospital when I was sick. My doctors are my caregivers. My skydiving partners are my caregivers. I also belong to 2 groups on Facebook, the Whipple Warrior group and Never Give Up, and there are hundreds of us, and we lift each other up. I also have an amazing family. I didn't find out till not too long ago that when I was first diagnosed, after I had my aborted Whipple, they all made a pact to never fall apart in front of me and not be negative in front of me. And I know that they have their moments when they're by themselves because I do the same thing. But to me, I appreciate that because I have my struggle and I have my worries. So for me to worry about my family, worrying about me is a little bit too much. And my sons have been amazing. And then there's my sister. She would drive 45 minutes to an hour to be at my every chemo. She organized my room, even my vomit bins and my towels. She works at Home Depot, so she had my backyard looking amazing. Then, of course, there was my #1 caregiver. My husband was amazing. He was sicker than I was. He was swollen from his legs down. You couldn't see his ankles or his knees. You couldn't even put floppies on. From his waist up, he was very thin. But he put me first over him. I would come home and I would say, honey, what are you doing? You're supposed to be lying down. And he would say, no, don't. It's not about me. This is about you. And he kept my yard looking really nice so that when I come home from chemo, I had a place to just relax and hang out. He encouraged me to walk and eat right and rest. He never complained. He took really good care of me. We took really good care of each other. I continue with my journey without my best friend of 38 years, and I carry him in my heart always. I owe it to him to stay strong. Then there's my faith. I would be lost without my faith. This is where I pull my strength, and this is where I stay emotionally balanced. Since day one, I have never felt sorry for myself, and I have never asked why me. I put my faith and trust in God, and since day one, and I asked him, what do you want me to do with this? The day that I had my very first CT. I was by myself in my room when the doctor told me that there was a mass on the head of the pancreas. And the first thing I did before I even called my family is I posted this little prayer I have on Facebook, and it says, "Look back and thank God. Look forward and trust God. Look around and serve God. Look within and find God." I now have a new spot on the pancreas and a new spot on the liver. But I've already beat this cancer. I inhale life to the fullest, the good with the bad. I don't let fear paralyze me. And I place my trust in God. This cancer could do whatever it wants to my body, but it could never touch my spirit or my soul, because this cancer, this cancer ain't got nothing on me.
There actually aren't many words to that could honor what you all have done in your lives to very actively live and support others. I mean, we heard so many things that can be useful to us, from getting mad and getting annoyed, faith, humor, staying active. Even if you're not a marathon runner, staying active actually can be very useful. And in fact, there's research that says that in people with cancer, and that's often the last time you want to be active. You're tired. Well, actually being as active as you can helps fatigue. And so staying active is something that I hear that's very important. Faith, advocacy, love. And love is a lot of what I'm hearing here that gets people through. And I'm wondering, in all those things, when you have a really bad day with cancer, can you tell us more about what you do in those dark times?
Well, one thing that helped me is having run so many marathons, I had already pushed myself to the limit. So when I would get so sick, I just would stop and think, what mile am I at? And then I would think sometimes at mile 20, 23, 24, at mile 24, everything hurts, even your hair. And you know it doesn't get any better, it only gets worse. But if you hang in there, that finish line is right across, right around the corner, and that's what I would hold on to time after time.
I'm unbelievably lucky because I haven't gone through a recurrence. I basically went through this in a year. It was kind of a crappy year, I'll tell you. But the way that I viewed it then, and the way that I view it now, when I'm having a Whipple attack, or when I'm too gassy to go out with anybody, or just those little annoying things in life, which pretty much are a daily thing, unfortunately. But it sure beats the alternative. I'm going to get through this. This is not the end of the world. I'm alive. I'm functioning in the world as a productive human being. I get to share my experience, strength, and hope with other people. Nothing better than that.
Ani, or
Go ahead.
I mean, I would love to pretend that I don't think about it a lot or don't have those dark days, but I certainly do. I think about it a lot. And it's kind of there all the time. And I think I've kind of just over the last year become accustomed to the fact that there is our life as a family is just going to be a little bit different. I'm by nature a planner. And I find that I tend to think far out more often than not. And I am trying at this point to just stay in the moment and appreciate where we are right this second, or right now, today. My mom being able to have caught the disease where it was, and then to have her be a candidate for Whipple, to have gone through it, and then to be here today is, in my opinion, a miracle. My brother and I look at each other sometimes randomly, and when cancer is being talked about, and we just go, you know how lucky we were, right? I mean, like, yeah. We certainly do. So I think just knowing how lucky we've been to this point in being here kind of helps think, okay, well, there's no reason why that shouldn't continue. And, we'll take everything day by day and just kind of try to be grateful for where we are right now.
Thinking about how bad things can be, and they are. Thinking of all the things that we have personally have gone through prior to my wife's diagnosis, I have to say, there is no good thing come from that. The only thing we can do is say we're given an extra moment, and we got to make that moment last a lifetime, because that's all I am going to be given for that one day, and I'll take that one day at a time. Okay? But more important for me, in the morning, I work 50 to 60 hours a week. And you're right, keeping busy is a very big element of being able to cope with what we're going through. But more importantly, when I get up in the morning and I have my wife laying next to me, I reach for her warmth of her body, then I know that God has blessed me one more day to express my love for her and my commitment to live with her and make her life as pleasurable, acceptable, and livable as she is able to have, because God does not promise us anything.
Why don't we throw it open to discussion from the audience? I'm sure that you folks out there have questions, comments to make.
If you do have a question, if you could please just step up to one of the two mics, we'd appreciate it.
Oh, thank you for making it easy.
You having a question?
I'm obviously seeking treatment now, but when I was first diagnosed, I had decided not to seek treatment. And the oncologist was very nice. He said, how are you looking at all of this? And I said, well, I've been with hospice for 25 years, and I've seen that people spend their last days seeking treatment that isn't very effective. I want to spend the last days with my family and my friends. And he said, fine. And I went on hospice for 5.5 weeks. And when I look back, I think it took more courage for me not to seek treatment than later to seek treatment. And so I was thinking it's kind of un-American to give up on anything, but it takes courage also to accept what's happening and not run after different treatments. So I guess I have some mixed feelings, because obviously I'm seeking treatment.
I had this conversation with my doctor, not that I was thinking about it, but sort of early on in my treatment, and marveling at the fact that people would make that decision. for me, it was pretty simple in that I have a resectable tumor, I've got a chance of living, and most importantly, I have a 9-year-old daughter at home. My mission was, I had one goal that I wasn't so sure I was going to be able to fulfill, but my one goal when I got diagnosed was to see my daughter into college. And that was because my mom's father, my grandfather, died when she was 16. She's now 78. She's still a damn mess. And I didn't want that to happen to my daughter. So, and that's, kind of the message of us being up here is that, yeah, it's all about me. Okay, really. At the end of the day, it's all about me. But it's not. Because I die, I'm done, whatever. The people that surround us, that provide us with the sustenance and the love and everything that makes your life worth living need to go on. And also, I mentioned, the experience, strength, and hope before. It's like, here I am, I'm a functioning human being, I have survived this cancer so far, and I want people to know that this is doable, that you don't have to give up with this diagnosis. Even an idiot like me can manage not to die. You can do it too.
I'll make a quick comment about that. I have trouble with the concept of giving up. And I think it depends what you mean. So when I hear your story, I think about somebody, who made an active choice. This is what I'm going to do with my time. And then you made a different active choice. Now I'm going to get treatment. To me, neither of those are giving up. And so I think that living an active life, or living as well as you can for as long as you can, however is best for you, that's what not giving up means to me. So I don't see giving up in your story.
May I add to that as well, looking from a caregiver's point of view? We don't want you to give up. You may be the beam of light that we need, that you may make the difference, and you may be the one that is needed to get us over and cross over this disease. So don't give up. You're an element is needed by participating in what you do, by allowing us to maybe grow by what you're contributing to us, by giving us that opportunity. Don't give up.
I think your wife wants to say something.
Hi, I'm Vic's wife. I'm not going to ask any questions, but I do have some comments to make. First, I'd like to thank Aggie very much for doing this. I don't remember how many years we've been coming, but it's been a very long time, and every year I learn something different and something new, of which I'm very grateful for. Also, every one of you in this room has been a great inspiration to me, and I want to thank you for that. Also, just a shout out to Chemo Wave real quick. I tried that. I'm on a survivor council, and I was asked to give it a try, a little trial run, as they say. I wasn't really anxious to do it, to be honest with you, but I did it, and I really have enjoyed it because if any of you know me, my nickname is, what am I? I'm an engineer, control engineer, I'm sorry. So for me, because I'm not really good about sharing things, it was really very helpful because I could go in and put in all the information. And when I go to the doctor and he says, "How are you?" And I say, "I'm great." And he says, "No, you're not. Let me see your phone." And he can look at my phone and he can tell different issues that have happened and kind of adjust the treatment as necessary for that way. So thank you for doing that and taking something very negative, I know, and difficult, and making it positive, because a lot of us will benefit from that. And also, I want to thank my husband for coming up here and doing this, and all of you on the panel for doing it. It's very difficult to share your story sometimes, but it is very inspirational. So thank you for doing that. And if anyone should ever be knighted or sainthood, it is my husband, trust me.
Roberta, you're too kind. I will have to say that I got to keep you going, because if I don't have a pain in my butt, you do not mean anything in my life. Thank you for that.
Well, even when I'm not here, I will be here because I will haunt him every day. But I also want to offer with Lupe and Susie, come and join us on April 7th For a jump, it's great. People ask me all the time, why do you jump out of a perfectly good airplane? For one, it is not perfectly good. It is very rackety, and the last thing you want to do, you want to hurry up and get out of there. But it makes me feel if I can go up 14,500 feet and jump out of an airplane, pancreatic cancer ain't got nothing on me. I can do anything that it tosses my way. So I want to, again, thank you all. Thank you, Doctor, for also explaining. I had always wondered about the why depression, if it came before or if it was part of the illness. So thank you for explaining that, because it really did put an end to it, and a great question. But again, thank you all for your support. I enjoy coming to this every year and seeing the same survivors, and I hope to see you all again, and we're all going to make that mark and see our survivors going to get better. And thank you for all your time and your love and your support and compassion. I love you all to death. Thank you.
Yes,
Okay.
you have a question?
Hi. Yes, my name is Deborah Morris. I first want to thank Lupe. I met Lupe on Whipple Warriors, and I had not even heard about Whipple Warriors until 2 years after I had pancreatic cancer. And she shared the event today, and Amy, thank you for making it all possible as well. I'm 4 years, 6 months post-Whipple, ampullary adenoma carcinoma in Vater. A 2 PT, no max. And, I just feel that I am a miracle. At the time, I didn't know that people could live and survive pancreatic cancer. I had a cousin that at age 50 only lived 2 months. And so I felt when I had it as a healthy 58-year-old woman at that time, that was it for me. And I was very blessed. I had my daughter and my son-in-law, which were living in Germany. I want to acknowledge them today. They flew out from Germany to help me. And if it weren't for them, I don't know where I would be today, But, since then, I've overcome that, and I'm a patient from UC Irvine, Dr. David M. McGowan. On my table, I have a patient that just sat down from UCR with Dr. David M. McGowan as well at my table. So it's just like we were put together here today. But I had a question. My question is that since then, we've had, genetic testing in my family, mainly because one of my nieces, she was a stage 4 triple negative breast cancer. And when she had genetic testing, it came up that she was positive for breast and pancreatic cancer. And then I had some concerns with myself. I had some lumps that I was following. And so then I had genetic testing and was looking at a bilateral mastectomy. And in that process, my daughter also, has had, testing. 6 members of my family have been tested, and out of those 6, 3 of them are pancreatic cancer ATM mutations. My niece that couldn't be here today, the triple negative stage 4 breast, also fighting juvenile diabetes, she has 2 children. One of them 11, one 13, and I have a daughter as well at age 30, So the concern is, how soon do you actually, like for these 11 and 12 years old, do you actually start doing testing, for for pancreatic cancer as a preventative aspect, and the same for my daughter at age 30? When do we start,
I think that generally speaking, without talking particularly about that family situation you described, when you have a genetic defect that appears in a family and the disease then becomes apparent, as far as the testing of others in the family who might have a similar problem, you look at the age at which the disease appeared, and generally speaking, say you begin to test 5 or 6 or so years before the earliest age that it became apparent in the family. There's no guarantee that you're going to pick something up, but you figure you don't want to wait till they're at least as old as the individual who came down with the disease. You begin to look for it some years before, so that if you find something, you can keep a close eye on that individual and hopefully make a diagnosis if it does appear before it's too late.
Okay. The other question I had, once you are, diagnosed that you have the genetic mutation, does that affect, your insurance, medically, for you in the future? Because people have fear of having that genetic testing for fear that then they would be blackballed or maybe, it would be a mark against them.
I think that the fear, obviously, is that it will. I'm sure it depends upon the particular insurance company, but it's a knotty issue that society needs to deal with as we become more and more sophisticated in terms of being able to pick up, detect genetic disturbances, genetic abnormalities. I think it's an area that maybe we should raise with President Trump.
Yeah. I have one more question about genetics.
Oh, I'm sorry.
I just had one more thing about genetics. Let's say that 6 members of my family were tested. 3 of them are positive, so we know that definitely they have a greater chance. What about the other 3? Are they safe?
I don't know.
Do they feel that?
Dr. Donahue may have a comment. Can you get her a microphone?
Yeah. I saw her getting lunch, so we identified that she's president. Now we're going to make her work for the lunch.
So my name's Wendy Conlon. I'm a genetic counselor, works with Dr. Donahue and Dr. Reber and the pancreas team. And there are guidelines for management for ATM that are espoused by major medical groups, and so I'd be happy to share those with you guys. We don't want to test minors, so children are not really psychologically or intellectually capable of understanding the ramifications of testing, and so we'd want them to be intellectually and emotionally mature to undergo that process, either in their late teens or maybe early 20s. But ATM has well understood risks, and we have guidelines for early detection of breast cancer using breast MRI. Colon cancers increase, so we recommend early and more frequent colonoscopies. And it sounds like your family history is significant for pancreatic cancer, and so we should screen for pancreatic cancer as well using EUS and MRCP, and we've got guidelines for that. So why don't you come find me afterwards and we'll have a chat.
I will, thank you.
Okay.
One other comment about that, and you ask about insurance companies. There's actually a lot of evidence for this on this point in breast cancer, because that's BRCA 1 and 2. And I've done some research in this area, not about insurance, but that was a major fear in the beginning of BRCA 1-2 testing. To this date, it has not come to pass that insurance companies drop you when you find out that you are positive. And so that was a fear that actually didn't come to pass. Now, I don't know about the future.
We have a federal law called the Genetic Information Non-Discriminatory Act, and it was passed in 2008 by a Republican president, George Bush Jr., and it's not part of the Affordable Care Act, and it protects all of us if we decide to get genetic testing for any condition that shows that we're at increased risk for some health outcome. So insurance companies cannot use genetic testing information against you to deny you health insurance or set your premiums based upon being at increased risk for some health condition. And so that's a fantastic piece of legislation that has nothing to do with the Affordable Care Act or pre-existing conditions. It just has to do with genetic testing itself.
Thank you.
Could I just, I want to launch off of something that I think her name was Deborah said. She mentioned the Whipple Warriors page on Facebook. And this has been on my mind lately. My brother-in-law was diagnosed with a type of throat cancer last week. He calls me up. My secretary at work comes up to me yesterday, tells me she's got breast cancer. What do you do in this situation when wow, didn't see that one coming. That changed my day a little bit. I didn't know about the Whipple Warrior page until I met somebody at a PanCan walk about 5 years ago. And while the internet is a horrible, horrible thing, if you've ever read the comments on any news story or something, you know how dangerous it can be. But on the Whipple Warrior page, where I see Lupe all the time, and I'm sure some of you are out there too, is, you know, you learn about the one drug that works for a Whipple attack. I talk to people all the time. They're like, A, what's a Whipple attack? And B, what is hyoscyamine, or however you pronounce it, which is the one thing that works for it. There are places you can go outside of the doctor, no matter how great he or she may be, that they're not going to know about, because they're an oncologist, or they're a technician, they're the mechanic that does the plumbing, whatever it may be. There are things that we, particularly as pancreatic cancer patients, experience that are really different from what the normal person does, or what anybody else experiencing a different type of cancer does. And that leads to my second point, is something that we were talking at the table about with the, what's your title again? Control engineer. That the control engineer, and it's that she was saying that it took her years essentially to go public with the fact that she had this disease. And when I got diagnosed, I wasn't quite sure what to do about it. Do I want people to know? Do I want to be pitied? Or do I want to be subject to whatever stuff happens? Insurance discrimination. I don't know. And it turns out I didn't much have the choice, because my daughter, who went to an Episcopal school at the time, brought it up in chapel, and it took about 10 minutes for the world to find out after that. What I found personally was it led to the most amazing displays of sympathy and support and comfort and generosity from people that just came out of the woodwork. So I had a support group at my daughter's school. I was active in affairs in my city. I'm active at work. There are other groups that I'm active with, and we set up a Caring Bridge page soon after, because all these people wanted to know. Caring Bridge is a website where you can post your medical stuff and this and that. You know, I had like close to 1,000 people that were reading this thing. I don't know 1,000. I don't know who the hell these people are. But having all of these people there and supporting me and giving me information. So, for example, I found my surgeon through a woman who was a parent at my daughter's elementary school. She's like, let me ask around, and we found someone that did residency with the guy that did my surgery. Said he was a stud when he was a resident. I'm like, cool, that's my guy, right? I have a relative who knows somebody that ran the Lustgarten Foundation out of New York, just like Aggie's foundation. And they hooked me up with Margaret Tempero. I got to meet with her like the next day because I knew somebody. I almost went up to UCSF to get treated, but it turns out that my best friend at work used to date a guy at City of Hope, who's kind of one of the guys. So I didn't have to go to San Francisco because I knew somebody down here. So this unbelievable collection of connections that I was able essentially to exploit, A, because I was public with it, I was willing to talk about it, and I didn't piss off pretty much everybody I knew in the world, fortunately. And it all worked out to bring me here today. So I don't know if anybody else has anything to say about that, but no.
No, I agree with Thom. I was opposite of, I guess, them. I was always, I'm an introvert, but when it comes to my disease, then I become an extrovert. I'm very passionate about it. But to me, like we all say, this isn't something that we would have chosen, but the people that I have met through this journey is just, I mean, I can't even express, you know, the connections are so important. The networking is so important. Sharing information when you meet new survivors and, you know, being able to help them, it just gives you such a feeling of satisfaction. And then you learning from the survivors that have survived longer than you, and then they give you hope because you want to be a 10-year survivor, a 15, 16-year survivor. So it's just making those connections is very important.
Looking from a caregiver's point of view, I know my wife was advocating very heavily into bringing awareness to finding any information about this disease because obviously she lost quite a few of her family members. Even though she was fighting for 6 years, it took her 6 years to come out and try to express some help for herself. And from a caregiver's point of view, I couldn't take that away from her. I would live that through day in and day out, and it took me 6 years before we actually came to the moment where she actually brought the knowledge of her fighting this disease. And to hold on to something that long, in my mind, I was waking up with it and going to bed with it, but I couldn't take that away from her. What she felt in the time that she wasn't advocating for herself was guilt because, like Thom and Lupe were saying, they wanted to do for themselves and express themselves to get the positive support that they were getting. In her case, it was her getting a guilt feeling because she talked about it one time and they made it seem like pancreatic cancer, it's a devastating disease, you're not going to be here tomorrow. And why are you living so long when I've lost my family member, I loved one, during a short period of time? And she was experiencing these guilt feelings. And looking from my point of view, I have to respect that. I needed to respect that. And I'll continue to respect her wishes, her desires, her actions, because she is the one that has to make that decision for us as a team together.
Hi, my name's Vanessa, and this is my first time here. So I want to thank you so very much. A lot of information. I wasn't diagnosed with pancreatic cancer. I have attenuated familial adenoma polyposis. So I got diagnosed with that in 2013. After that, in 2016, I got diagnosed with desmoid tumors. Had a surgery and got reoccurrence for that. 1 was removed and 3 more came back. I thought it was okay. I have 4 kids and a husband. We did genetic testing, and 3 out of my 4 kids have attenuated familial adenoma polyposis. More recently, I had gotten sick. I went on a health eating. I was going to get clean eating, and with that, I got sick. Ended up in the ER, and we did an endoscopy, and they found a tumor or a polyp, whatever you want to call it, in my duodenum. So March 28th, I'm going to have my Whipple. So my kids are 19, 17, and 12 and 4. I'm like a lot of people. I don't cry and I don't feel in front of my family. I gotta stay strong, and I don't indulge in what I might be feeling or going through that day, because I don't want it to affect them, and I don't want to burden them. So, my question for you guys is, I don't know, any positive things? What should I do with the kids? I mentioned counseling. They don't want to do that. And so I'm just very grateful to be here and to see a lot of faces that are survivors of a Whipple. My mom has obviously the FAP, and she did actually get diagnosed with pancreatic cancer, stage 4. She's fine now. So, but hearing that, you know, it could be genetic, and my doctors know me as the 1%. If I have a 1%, I got that 1% so far. So now hearing that it could be hereditary, now I'm like, okay, I got to go back, you know, to the geneticist and figure out what do I got to do? Are there symptoms that I need to look out for? I don't know. So that's it.
My heart goes out for you. I will say that don't give up. Listen to yourself. Take a breath, take a moment. Think of what you're about to do, what it's going to develop. And certainly engage your family. They need you as much as you need them. And also, a great thought of is keep the faith. And the one thing that I live by is God has given me crosses, but he's never given me crosses heavier than I can carry. They might seem like, excuse the expression, it may seem like a bitch, but we'll get a load of it. He'll give us the opportunity to overcome it.
My kids were grown when I was diagnosed, so I can't even imagine. But I always tell people, with or without cancer, there's no guarantee you're going to wake up to tomorrow. So I would just say enjoy every day, every moment with your kids, and inhale life, the good with the bad.
You are a badass and a warrior.
I think it's amazing that well, and natural that you don't want to burden your kids, but you have a couple of kids that are older, and I think it would make them feel better for you to burden them, you know, and bring them into the process with you so that they are not left wondering and misinformed or just in their own head about what's going on. You know, I would keep them very much close to the process if they're willing to be. And I think just honesty and just being very straightforward with what's happening. You know, when my mom went through chemo, like I said, we have, you know, between myself and my brother, we have 3 small boys. I have at that time, an 8-year-old, and my brother's children were 9 and 3 at the time. And my mother just sat them down one day and said, you know, Mimi's sick and she's going to get better, but she's going to get a little more sick before she gets better. And I'm going to shave my head, and that's going to be a step in the right direction, and that's going to be part of my healing. And are you okay with that? Do you want to see that, or would you like me to, you know, not expose you to that? And they all said, no, we want to see it. We've never seen a bald lady before. You know, they were kids. They had a kid's reaction. But I feel like but there was nothing that was terribly startling to them, and or anything that made them feel very uncomfortable. I mean, they were sad. They knew that we were sad and worried. But if I could say, you know, as the child of a patient, is just be very open and straightforward and keep them close to you in terms of information.
You know, you're right, because even though my boys were grown, I did have my grandchildren. And I know after I had my Whipple scar, my little granddaughter, that was like 6 at the time, I was like, oh, I want to see her shark bite. You know, because they'd see the scars. And then my other grandson, at the time, he was younger, and he wrote me a song, and I have that on YouTube. So they don't understand 100%, but, you know, it is important that they know what's going on.
You have a question?
And I am from Hacienda Esperanza. Esperanza means hope. And we strive to instill hope in people to create a life they love through therapy with horses. And this is how I met Lupe. She exemplifies creating a life she loves and is instilling hope in others. And my question I have for you all is, what is the advice to providers on how you want to be treated along this journey? Or the best experiences with healthcare providers who have treated you along the way? And or the opposite, what would you tell them not to do and not treat you in any way?
Well, I wouldn't want anybody to treat me any differently. And I have received the best care and respect from my caregivers. The only two things were that when I was at the community hospital where I was first diagnosed, nobody told me to go anywhere else except for that one radiologist. And then the other thing is that when I chose to be on the aggressive chemotherapy and the tumor board decided not to because they felt it would impact my short remaining life, I knew what I was facing, and that was still my choice. And I felt like that should not even have been in question. Those are the only two things.
The first oncologist I met with said, "I won't give you FOLFIRINOX. It has not been studied in an adjuvant setting." And I said, "See ya, dude." I mean, really, we can't even have a conversation about it. But, you know, I am super happy with the people I'm with. But I'll tell you, when I talk to new patients, which I do on a regular basis, I say, you got to go to UCLA. They're doing this team approach there. They got the best thing going on in Southern California. That's where you need to go.
What I've learned is to look, listen, be observant, be patient, be understanding, and be compassionate. That's all we can offer them. We need to learn from them what we could do for them.
I think maybe one more question over there, please.
It's not really a question. It's more like a thank you. I'm here on behalf of my husband. He couldn't make it. We were here last year. We had a lot of information, and she made me feel at home. I felt that I found my family. Unfortunately, my husband passed away last November. And I am a true believer that someday we're going to be here, sitting here, and we're going to be discussing that we found the cure for pancreatic cancer. And we're going to be here. And it's more like a thank you. Thank you for everything. Thank you.
It's probably just a question that would be addressed to all of you, if you don't mind me asking it real fast. In representation of a few people here, I'm sure. So many great things we heard about UCLA today, so thank you very much for sharing that. For people that don't have health insurance that would cover UCLA, what would you recommend for these people who desperately seek for your help?
Dr. Hines has a comment.
You know, the state provides a fair amount of sort of emergency assistance to get insurance through Medi-Cal. Medicare does the same, and lots of times once you come on board, the service that you've received already that hadn't been covered can be kind of backed out. So not having health insurance does not preclude you from being seen at UCLA or any other state institution in the state. So I would just sort of focus on, I got this problem, we're going to keep pushing forward. And usually most institutions, most groups have resources to be able to tap in and get that insurance pretty quickly so that you can be seen and get on track with the plan.
Thank you, Joe.
Okay, in that case, it was fantastic to see you all. No kidding. Hurts, huh? A little bit. It was beautiful. So maybe we'll have a summer barbecue again because we love each other so much at my house. And for sure, I'm going to see you here next year. And the executive director of the foundation is my daughter, Lisa Mannheim. Everybody loves Amy. Sarah, who, if you want to do an event for us or raise money for us, she's the one to speak to. She knows exactly what information to give you. Natalie makes sure that we all have everything and manages the office. And Martin is in charge of the marathon and did dye his hair purple for the event. Lastly, I do want to thank our sponsors. Ken and Joanne Weinman made a wonderful donation and insight as well. So I thank the sponsors.